Diabetes is a difficult diagnosis to treat.
I had a lot of doctors knowing that something was different about my type of diabetes.
Having a genetic diagnosis for a disease is very empowering.
Diabetes is a disease that affects more than 20 million adults and children in the U.S. But with a recent discovery of mature onset diabetes of the young, or MODY, some diabetic patients may not be getting the appropriate type of treatment. MODY is as common as type 1 diabetes, yet it is often misdiagnosed.
I was diagnosed with diabetes when I was 15 years old. At the time I was diagnosed, they gave me statistics, the chances of me going blind, the chances of me having dialysis.
For more than 30 years, Marie McGann has suffered from diabetes and the demanding regimen of therapies used to treat the disease.
I was testing my blood sugar 8 to 10 times a day. I was taking 5 to 6 shots a day before I got put on an insulin pump. The insulin pump would sit on the outside of my body, so everybody knew I had a pump. Where it went into my skin was never comfortable. I mean, I always felt it.
But there was something unusual about Marie's diabetes in that she never presented with any of the typical complications that often occur among type 1 diabetics.
Marie had diabetes for over 30 years, was on insulin for over 30 years, and she suffered no eye complications, no heart complications, no kidney disease, and no neuropathy or foot disease. She only required a small amount of insulin through her insulin pump. That's what signaled to me that it's highly likely that she did not have type 1 diabetes.
When Dr. Redgear suspected that I was a MODY patient, she said that she thought that I should get tested, so we had a for sure diagnosis and we knew what we were treating.
MODY's simply been misdiagnosed as type 1 or even type 2 diabetes because we did not have all of the genetic testing.
A simple blood sample was taken and sent to Athena Diagnostics, where the DNA was then extracted, isolated, and sequenced to look for a MODY mutation.
It's very exciting to be able to offer genetic testing for MODY because the test results can alter the treatment for the patient. Once you understand the genes that are involved, then a specific mutation really opens up the whole process in this individual so they can understand what specifically is not functioning correctly. Making the determination as to whether a patient has type 1, type 2, or MODY really can offer better treatment options, better prognosis, better prediction of disease.
It wasn't long after I had the genetic testing that they called and confirmed that I was a MODY.
Individuals with MODY may be able to switch from insulin to oral medications, or may even be able to make changes in diet and exercise to control their diabetes.
Since I was diagnosed with MODY, my life has changed completely. I'm still diabetic. I still have to check my blood sugar. I still have to be aware of things that diabetics have to be aware of. However, I'm not sporting around insulin. I don't have a pump on. My highs and lows are just not all over the place like they were. I can live essentially a very normal life.
She's now been off of insulin at this point for almost 4 years, and her quality of life is much improved.
I take a pill and a half every morning and a pill and a half at night.
I should have put some nuts in them.
Too late now.
We've also been able to diagnose other family members for her.
My youngest daughter was diagnosed with diabetes 3 years ago, and because she's MODY, her life is not what my life was when I was 15.
MODY is oftentimes found in families. Usually if one family member is affected by it, there's a strong chance that the offspring will be affected by it.
When I found out that I had diabetes, I was a little nervous because it's just a different thing for a 15-year-old girl, just finding that out that you have a disease. But just knowing that it was MODY, it made me feel a lot better because I knew that I wouldn't have to be worried so much about my shots or my blood sugar, which I do still have to watch, but with MODY it's a lot easier to control and take care of.
She also still has this window of opportunity to simply be treated through proper diet, daily exercise, and so we can delay and postpone medication for some time.
If I hadn't been diagnosed with MODY and I had type 1 diabetes, my life would be a lot different, I think. Just seeing how my mom had the pump and everywhere we went she'd have to go test her blood sugar, take the shots. She had to not eat certain things. And I can eat whatever I want, I can run around, be active, I can do whatever I want.
They're good.
I would like family practice doctors, internal medicine doctors, pediatric endocrinologists, and adult endocrinologists to know and realize that MODY diabetes may be more prevalent than what we ever thought in the past.
Being diagnosed with MODY has given me a lot of freedom that I would have never experienced. I'm grateful for the diagnosis.
To learn if you have MODY, ask your doctor about Athena Diagnostics genetic testing or visit modyawareness.com.